changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
The opinions expressed in the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of the station, its staff, management, or sponsors.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor Living a Longer and Healthier Life show. This evening we're going to be talking with Dr. Cary Zinkin. He's a doctor of podiatric medicine at Amircus in Deerfield Beach, right around the corner, so that's great. We're going to be talking about diabetic foot and non-surgical options for foot care and a whole bunch of other topics, I should say from head to toe, because it really affects it all. Dr. Zinkin, welcome to the program. How are you doing this evening?
Great. Thank you, David. Thank you for having me, and thanks for being interested in podiatrists and podiatric medicine. It's my pleasure to be here.
Definitely. Besides primary care, was the first doctor that I ever went to, and I'll talk a little bit about that a little later, was a podiatrist. So I'm glad to have you here. Let's get right into it, though. Please tell the viewers and listeners a little bit about your specialty, podiatric medicine.
Well, great. A podiatrist is a doctor of podiatric medicine. We go to college for pre-medical studies. We go to podiatric medical school, 4 years, medical degree, and then we do 3 years of surgical residency afterwards. We're together with the MDs in a lot of cases in some of the schools, taking all the basic scientists and stuff together, and then we spread out a little bit and go to the lower extremity a little bit more. Any medical or surgical condition of the foot is what we do. Anything whatsoever. Skin, nails, injuries, fractures, circulation, you name it. If it's the lower extremity, we're the premier foot and ankle doctors for you.
That's nice. No, that's a great explanation, too. So, obviously, we're here in South Florida, got a lot of baby boomers now. My parents are baby boomers. I think it's still the largest population right now in the U.S. And then also that, obviously, senior citizens and the geriatric. And I always talk to doctors on this program, and they always tell me, I have a patient that's 10, I've heard 106, 109.
Yeah.
We've heard of 112. I mean, people are living longer than ever. So how can a podiatrist or podiatric physician help that population?
Great, and you can use podiatric physician or podiatrist interchangeably, just so everyone knows what we are. The best thing I could do for our local listeners is to tell them exactly what a podiatric physician does, and different ways of taking care of your feet, depending upon what age you have, depending upon your medical status. We treat sports injuries, infections, ingrown toenails, diabetics with ulcers, wounds, and we also do surgical correction and salvage as well, and amputations.
Nice. So yeah, that you run the gamut on the foot, like you said, and ankle, I should mention as well.
And the new people graduating from school are amazing surgeons. They are just fantastic, the best in the world.
That's great to know, because time's moving faster than ever, it seems like, and the population is getting a little older for the time being. Let's get right into a little bit about one of the things that have come to the forefront in care here in South Florida and beyond is the diabetic foot because of the rise of diabetes.
Yeah.
So when that term that's been thrown around, you do a lot of media. That's what the media grabs diabetic foot. What is the diabetic foot?
Well, I mean, diabetes is a whole month dedicated towards Diabetic Foot Care Month back in April. Diabetics have special problems. When you're younger and you become diabetic, not so much. It's more about watching your blood sugar. But the older you get and the longer you've been a diabetic, the more chances you have of getting complications. Complications in the lower extremity are as follows. You get increased neuropathy. We call it peripheral neuropathy, which is tingling and numbness, burning sensations. And that's all due to the fact that your blood sugar is a little bit higher than it should be, even when it's controlled. It's higher than normal, and it affects the peripheral nerves, the nerves on the outside. Also, many times it will affect your circulation as well. Diabetes is a disease of microcirculation, so the ends of the toes will be affected. There's no circulation, there's no growing, and there's problems.
Now, if someone feels like numbness or tingling or maybe no feeling at all on the end of the toes, is that a good time to make an appointment with a podiatrist?
That's always a good time. In fact, what we say as podiatrists is pain is never normal. And anything that hurts you like that, if it lasts for more than 2 days and doesn't resolve, then you need to see a podiatrist.
Oh, that's good to know. And now, why do you think diabetics tend to have foot problems? Because I feel like that goes hand in hand. I mean, we always hear of people not having feelings in the bottom of their foot and maybe stepping on something. I know you've probably seen this many times. Someone walks into your office with a tack in the bottom of their foot, or maybe even like a nail and not even know.
You're absolutely right, and that happens all the time. And one of the things we try to do to prevent that is to teach our diabetics to wear shoes all the time, good foot care, how to take care of themselves. But yes, we do, because their circulation and their nerves, they numb, they can't feel the bottom of their feet. They step on a piece of glass, maybe they broke in the kitchen a week before. Now they don't find out for a couple of days when they see something coming out of their foot that's not like I want to describe on the radio. And now they can have an infection. They can have something really bad. So there are preventative things that we teach our diabetics to do, such as wearing good shoe gear, wearing socks, keeping their feet clean, soap and water. Many of my diabetic patients will say, "What can I use on my feet, doctor?" Soap and water, the best thing. And I always tell them, I'm not trying to be funny. This is soap and water, dry really well between your toes. Always wear socks, always wear shoes, and you're always protecting yourself.
A good point there, between the toes. That's an area that's forgotten. I mean, we're all guilty of it. I'm just thinking the last time I got in between, you know what I mean? Like, when you have that soap and water, get in between your toes too, obviously, because things can manifest in between there.
That's correct.
Okay. We're here with Dr. Cary Zinkin. He is a podiatric physician. He's with Amircus, Deerfield Beach, right around the corner. And they are located at 1979 West Hillsborough Boulevard, Suite 1. Like I said, Deerfield Beach, 954-426-8833. There's a great bio on Dr. Zinkin there, amicusmedicalgroup.com. You want to read a little more, we're going to be mentioning some of his accolades here in a moment. But getting back to that about footwear. So as a diabetic, now there's different kinds of shoes, maybe for making sure when we're in an area where we could be stepping on something, or if we want to maybe go walking or exercise, there's different types of shoes we should have. It's not like one size fits all.
That's correct. However, for diabetics, years back, Medicare started a shoe program that if you're diabetic and you have neuropathy or bad circulation, callus that could become an ulcer or an ulcer itself, that you qualify for diabetic shoes to be covered by your insurance. And that's been great. And basically these days, they're not the big old orthopedic shoes they used to call years ago. They're really like running sneakers with special inserts in them that they mold to your foot. And they help take the pressure off certain areas, protect your feet, give you good arch support, and and protect you overall. It's one of the best things that have happened in diabetes over the years, is being able to protect their feet with shoes and cover it.
And I appreciate you taking the time to make that point, because as I did some writing in healthcare in the last few years, one of the testimonials that I did was a gentleman who had diabetes, and he had a massive blister start from a little imperfection in a shoe he was wearing. Because, shoes are mass produced, and, the ones that are mainstream, they sometimes those things rub, and, over time it kind of just evens out for someone not with diabetes. But for someone with diabetes, that imperfection rubbed a perfect blister, which he told me went down, it became badly infected, and went into his Achilles tendon, which became infected.
Right, and that's serious.
Whoa.
Now it's serious. Now you need to go to infectious disease. You need to be on, get a PICC line and have, antibiotics for a long time.
We want to prevent that before it happens.
Yes, and just like you say with the shoes and protect, 25% of patients with diabetes will develop a foot ulcer in their lifetime, and the shoes help prevent it. 85% of lower extremity amputations are due to diabetic complications. So it's so important for diabetics to come to the podiatrist to be checked several times a year at least.
Nice. And we're here with Dr. Cary Zinkin, Doctor of Podiatric Medicine. We're going to be here till 6:30. The number is 888-565-1470, or you can ask us a question on Facebook. If it's, a great question, we may get it on the air here. Dr. Zinkin, another thing, what is, besides diabetic foot, what are some of the most common ailments that walk into your office?
And you say, walk into the office, right? Pun intended, right?
You got me there.
Thanks, David. And they walk one way or the other. Some of the most common things are ingrown toenails, heel pain, plantar fasciitis, and ingrown toenails. Some of the most common causes are tight shoes. They're also hereditary. If your father, mother, grandparents have history of that, you might as well, because it's kind of the way the root on the bone grows from the edge of your toes, and it can be hereditary. It's also very often people don't cut their toenails properly, so they can cause ingrown toenails and infections. Heel pain, we're in South Florida, right? Everyone wears flip-flops, whether they should be or not. They're wearing flip-flops. Flip-flops do not give you any support, any protection, and all the weight of your body is going on this thin little flip-flop, and you can get heel pain. It's a lot of strain and a lot of stress on your heel. Plantar fascia is your arch. You get stretching, and you get tearing. Those are very, very common. The funny thing in podiatry, though, is everybody who comes into the office, if it's not an ingrown toenail, they say, and they have pain in their foot, they say, I have plantar fasciitis, because they went online and that pops up first. But plantar fasciitis and heel pain, they go hand in hand.
The Google got you there. I know.
Dr. Google, that's what it is.
They come in there. Well, Dr. Zinkin, hold that thought. We're going to take a quick break on the other side, talk about the least common ailments you see, and if a referral is needed to see you, and your insurance is that you take on the You and Your Doctor show.
We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call
Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hello, South Florida and beyond, and welcome back to the You and Your Doctor Living a Longer and Healthier Life show with Dr. Cary Zinkin, podiatric physician. Dr. Zinkin, we talked about some of the most common ailments that walk into your office: heel pain, ingrown toenails, plantar fasciitis. What are some of the more least common ailments that you see?
You know, I don't keep count, but I'd have to say probably skin cancer. You can get skin cancer on the foot. It's one of the less common things that I see. You know, seeing so many ingrown toenails and the heel pain and the plantar fasciitis, it's a little less common in my practice. But it's not any less important because you can see any kind of skin cancer, including malignant melanoma. So everyone who comes into the office gets a check for their circulation, their nerves, and a good skin exam.
And that's good to know. In the office, Dr. Zinkin is Hillsborough Boulevard's 1979 West Hillsborough Boulevard, Suite 1, Deerfield Beach, 954-426-8833. And the website is amircusmedicalgroup.com. You can find info there as well. Interesting thing, you mentioned melanoma. We all know the story by now. Bob Marley had melanoma under his toenail.
Yeah.
So he didn't know at the time. So least common ailment you see, that's kind of good to know though, but you still run the gamut of those tests, and that's also good to know. Is the referral needed to see a podiatrist?
That's a great question because insurance with podiatry, podiatry is covered on pretty much all the insurance. Not pretty much. It is covered on all the insurance, but sometimes in different ways.
Mm-hmm.
So, for example, like within the HMO system with Humana, they don't require a referral for podiatry. Some other companies don't, and some do. And referrals, of course, they have to go through the primary care doctor's office. They're the gatekeeper of medicine. So they get to determine who gets referrals and who doesn't. But most of the time, it's not. For regular straight Medicare patients, it's not. You can come in, anytime. And you can, if you're not sure, just call us. We'll be able to tell you what you need to come in.
And same with insurance. You take most insurances, and again, call you guys.
Yes,
and you'll
exactly.
Be able to.
That's everyone's a little different with that, but usually if it's a call, we'll be happy to help you, get you feeling good.
Yeah, and I know just from being on the patient side and the doctor side as well, insurance can be a little tricky. So the number again, 954-426-8833. Call Dr. Zinkin's office if you have any questions about insurance or referrals or anything on this program. Give him a call. Again, it's 954-426-8833. What is today's podiatrist?
Today's podiatrist. Well, today's podiatrist is a physician, is a surgeon, and we are. It's an ad and with a tagline for the American Podiatric Medical Association because we want everyone to know that we are physicians, we are surgeons, and we're specialists, and we take care of anything and everything to do with the lower extremity. And things, medicine changes in all times. The training that the younger residents are getting now is far superior to the surgical training that I got. I'm not an old guy. I'm just saying now. The new guys, it's just amazing, and their techniques and everything. So today's podiatrist is really who they are. It's the younger people that are doing incredible medicine and incredible surgery, graduating, with incredible talent.
That's great to know because I have a feeling that in this country, foot issues are probably not going to be going downhill. They'll be going uphill.
They're not. 75% of all adults in the United States will experience a foot problem in their lifetime. And 48% of adults experience pain from their footwear. So pain in the foot and different footwear as it changes, that keeps us...
We're not only talking women high heels, we're talking men as well. And like what you said, I didn't even think about South Florida. Here we are, fun in the sun. And I know a couple teachers, and it's like if they're not working this summer, it's like...
Flip-flops on, that means...
they're on for the whole summer. Like, this is my time. I'm going to enjoy South Florida.
Fortunately, the teachers can dress a little down, and I have one daughter that is a teacher of music, and one daughter that's actually a pediatric ICU nurse, and everyone's wearing sneakers, more or less. It's the flip-flops that can get you in trouble if you wear them too much. But the sneakers are the best. And listen, and you talked about heels. You know that the average high heel owner owns at least 6 pairs. That's what it says nationally, in a national poll. South Florida, I don't think so, David. 6 pair? I'll say 6 pair on one shelf, maybe. Not in the closet.
There's some big closets here in South Florida.
6 pair is just what they bought for the last week. So yeah. So I think I'd probably put a 0 after that and put 60 pair at least.
And one of the things you didn't mention before as a most common ailment is bunions, and sometimes I'll let you explain, but I think it has something to do with the stretch that goes on there. Can kind of.
Well, bunions is that big bump against the big toe there. We call the first metatarsal phalangeal joint. And it's caused by several things. It could be hereditary. It very often is hereditary. If your mother, grandmother had bad bunions, you have a really good chance of having a bunion. That's
interesting.
It has to do with your foot structure, the way you walk, the type of shoes that you wear. Yes, the ladies who have been in very high heels all their lives, they're a glutton for punishment for bunions and hammer toes.
Yeah, so it can develop. But if it does, we have Dr. Cary Zinkin here. You can give his office a call. It's amircusmedicalgroup.com, and I'll give you that number again as well. They're right around the corner here in Deerfield Beach. The number is 954-426-8833. Again, amircusmedicalgroup.com. At 1979 West Hillsborough Boulevard, Suite 1, Deerfield Beach. I imagine you get obviously a ton of Broward County patients, a lot traveling from Palm Beach as well.
Yes.
Miami-Dade too.
Yes, as a matter of fact. And the cool thing is working for Amircus is I get to work with. I'm the only pediatrist. So I'm chief of pediatry, of course, and I work with a lot of really, really talented internal medicine docs, and they send me to 6 different offices in Boca, Palm Beach, Boynton Beach, Pompano, and as well as Deerfield, and so I get to work with a lot of different people, and we have dermatology and now an eye doctor as part of the practice, but it's great doing medicine with all of them.
Wow, I'm glad I asked that question. You have 6 different locations that you're at, and you said, Palm Beach, Boynton, Boca, Deerfield, Pompano.
Right,
yeah.
And Amircus has even more offices, but that's the ones that I cover, actually. So,
wow.
It's really fantastic. It's great.
That is great. We kind of touched on this. How can podiatrists help the public? I think there's so many different ways that we've covered so far, but...
Again, I had said pain is never normal. If you experience pain and it doesn't go away or get improved within 2 days, you should see a podiatrist. We're a wealth of information regarding, foot health and shoe gear. 62% of all adults in the United States want their feet to be more comfortable in their shoes. So some of the things that we do are talking about shoes and different shoe gear, what's appropriate for that patient, whether it's a sport or every day, or the waitress that's standing on her feet or his feet for so many hours, occupational. So we're a wealth of information when it comes to that. And if you've got a foot issue, just give us a call.
And we got about a minute and a half. So my favorite part is media. I love medicine, but media. So you're spokesperson for the American Podiatric Medical Association.
Yes, I'm honored to do that. I've been doing that for a long time. I enjoy the radio and TV and stuff like that. All the media, it's just fantastic and it's a lot of fun. Our association, not just the Florida Podiatric Medical Association, but the American Podiatric Medical Association, apma.org.
We got 1 minute.
We have amazing amount of foot health information on that site, apma.org. So if you feel that you need a podiatrist and you want to find someone near you, go to apma.org, click on Find a Podiatrist, and put in your address, and there you'll have it.
Fantastic. We got about 30 seconds. Hobbies and passions on life outside of medicine?
Oh, yeah. I play guitar, piano, I sing, I play for weddings. I've been a professional musician my whole life. I know medicine and music are two totally different things. I love them both passionately, so I'm a mix of both.
That is awesome. Again, Dr. Cary Zinkin, Podiatric Medicine, 1979 West Hillsborough Boulevard, Suite 1, Deerfield Beach, 954-426-8833, amicusmedicalgroup.com. Thank you, Dr. Zinkin.
Thanks, David, for
Great
having
interview.
me. My pleasure.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.